Hello everyone, and thank you for being here today. Today we'll be talking about a topic that sits right at the heart of early intervention, identifying developmental red flags from birth through 9 years of age. Every one of you plays a critical role. You are the people who see children regularly. You observe them in clinical settings, in classrooms, on playgrounds, and in their daily routines. You're in the best position to notice when a child isn't meeting typical milestones or when something, big or small, just doesn't feel quite right. We know that developmental concerns affect a significant number of Australian children. Around 15% of children under 5 experience some form of developmental difficulty, and when we look at school entry data, up to 1 in 4 children show vulnerabilities in at least one developmental domain. That's a huge portion of the children that we work with. The good news is that early identification truly changes outcomes. The earlier a child receives the right support, the more we can shift their developmental trajectory, strengthen their skills, reduce later difficulties, and support families through informed, evidence-based intervention. Over the next 30 minutes, we're going to walk through developmental red flags across different age groups from birth all the way through to 9 years. We'll look at what to watch for, why certain signs matter, and what steps to take when a concern arises. We'll also look at real examples and talk about when referring on is appropriate and how to do that in the most supportive way. Let's begin by grounding ourselves in developmental milestones. When we talk about developmental milestones, we're referring to the skills that children typically acquire as they grow. These cover 5 broad areas: gross motor skills, fine motor skills, language and communication, social and emotional skills, and cognitive development. Now, it's really important to emphasize that there is a range of what's considered typical. Children don't all walk at the same age. They don't all start talking at the same time. Some are fast at motor milestones, but slower at language, and that's okay. The challenge for us as professionals is figuring out the difference between healthy variation and emerging difficulties. That's why in Australia we use the concept of developmental surveillance rather than just screening. Developmental surveillance is ongoing. It involves listening to parents and carers, observing the child in different contexts, using validated tools such as the PEDS, the Ages and Stages questionnaire, or Brigance, and using our own clinical and educational judgment. Milestones are guidelines, useful markers, but what they really give us is a structure for noticing when something might be drifting off track. So why do we focus on red flags? Because they help us recognize when a child may be struggling in one or more developmental areas. A red flag doesn't mean a diagnosis. It doesn't mean something is wrong. What it means is that something is different enough that we should pause, take a closer look, and potentially explore further assessment or early intervention. We know that early intervention is one of the strongest predictors of improved outcomes across all areas of development. Children who receive help early have better communication skills, academic outcomes, social relationships, emotional regulation, and long-term mental health outcomes. One of our biggest challenges in Australia is that many children with mild to moderate developmental difficulties aren't identified until they start kindergarten or school. By that time, delays have already begun to affect learning, behaviour, and peer relationships. Another reason red flags matter is because the old wait and see approach is no longer considered best practice. We now have strong evidence that if a concern arises, it's better to investigate it early. Even if nothing is found, We've reassured the family and minimized risk. So why do we focus on red flags? Because they help us recognize when a child may be struggling in one or more developmental areas. A red flag doesn't mean a diagnosis. It doesn't mean something is wrong. What it means is that something is different enough that we should pause, take a closer look, and potentially explore further assessment or early intervention. We know that early intervention is one of the strongest predictors of improved outcomes across all areas of development. Children who receive help early have better communication skills, academic outcomes, social relationships, emotional regulation, and long-term mental health outcomes. One of our biggest challenges in Australia is that many children with mild to moderate developmental difficulties aren't identified until they start kindergarten or school. By that time, delays have already begun to affect their learning, behavior, and peer relationships. Another reason red flags matter is because the old wait and see approach is no longer considered best practice. We now have strong evidence that if a concern arises, it's better to investigate it early. Even if nothing is found, we've reassured the family and minimized risk. At this earliest stage of life, we are looking for the foundational building blocks of all later development. These months tell us about neurological function, sensory processing, and the beginnings of social connection. A few red flags are especially important. One is no response to loud noises. While babies at this age may not always startle dramatically, a consistent lack of reaction to high volume sounds is a concern for hearing function. Because hearing is so critical for later spoken language, even subtle concerns here should prompt early hearing screening. Lack of visual tracking is another early sign. By about 6 to 8 weeks, babies should be able to briefly follow a caregiver's face or a high contrast object. If you observe that a baby stares blankly, doesn't follow faces, or doesn't seem to notice movement, this may point to visual, neurological, or broader developmental concerns. Another key red flag is no social smile by 2 months. The social smile is one of the earliest markers of social engagement. It's not just a facial expression, it's a sign that the baby recognizes and responds to human interaction. A delayed social smile can indicate challenges in social emotional development or early markers of autism spectrum development. Finally, persistent difficulty moving the eyes or constant eye crossing may reflect problems with muscle balance or visual tracking pathways. Parents usually notice something is not quite right early on. If a parent says, "My baby doesn't look at me," believe them. Parent intuition is often accurate. At this age, red flags rarely show up in isolation. Instead, they cluster. One concern is enough to warrant further monitoring. Several concerns should prompt immediate referral. From 4 to 7 months, we expect babies to demonstrate increasing physical stability, vocal experimentation, and social interest. These abilities lay essential foundations for communication and motor development. Let's look at head control. Persistent head lag at 5 months is a major red flag. By this stage, neck and trunk control should be strong enough to support smoother transitions into sitting and head lifting. Persistent lag indicates the need to investigate motor tone, strength, and possibly neurological conditions. Next, consider vocal development. Babies at this age should be producing cooing sounds, experimenting with pitch, and beginning to babble. Babbling isn't just cute, it's a rehearsal for language. When there is no cooing, babbling, or laughter, this is a meaningful communication red flag, often indicating hearing issues or early language delay. We also pay close attention to social engagement. The baby should be smiling responsively, engaging with faces, and beginning to show excitement during caregiver interaction. A baby who appears passive, rarely smiles at others, or doesn't respond socially may be showing early signs of developmental delay. Motor red flags also show up early. A baby who doesn't push down through their legs when held upright, or one who seems excessively floppy or unusually stiff may require referral for physiotherapy or pediatric assessment. In this age group, delays can be subtle. Professionals often underestimate concerns because babies still appear young, but this is exactly when early detection is most powerful. Between 8 and 12 months, children typically become far more intentional in how they move, communicate, and interact. One major red flag here is not bearing weight on the legs. Most babies at this stage love to bounce, stand with support, or pressure through their legs. A persistent inability or refusal to take weight suggests gross motor delay or tone differences. Another important sign is dragging one side of the body during crawling. A child who consistently uses only one arm or leg or drags one side may be showing early signs of unilateral weakness, tone asymmetry, or neurological differences. Social communication red flags also become clear now. By 9 to 12 months, we expect joint attention. The child looks at something, then back at the adult to share interest. If a baby shows little interest in sharing experiences, or if they don't point, show objects, or mimic adult behaviors, this can signal early autism-related differences. We also look for the emergence of consonant sounds like M, M, B, B, or D, D. If a baby is not producing any consonant sounds by 9 to 10 months, this suggests a need to explore hearing, oral motor strength, or language development. Finally, social games like peekaboo or clapping games tell us a lot about engagement, reciprocity, and anticipation. A lack of interest in these games can signal concerns in social or cognitive development. By this age, patterns become clearer. If you're noticing more than one red flag, early referral is strongly recommended. By 1 to 2 years, toddlers typically demonstrate a rapid explosion of mobility, curiosity, and early communication. This age brings some of the strongest and most predictive red flags. First, toe walking beyond 18 months, while occasionally seen during learning to walk, becomes concerning when it persists. Toe walking may be sensory-based, habit-based, or linked to neuromuscular conditions. We also look at how toddlers understand and interact with familiar objects. By 15 months, children should know what a cup, spoon, brush, or ball is for. If a child doesn't seem to recognize or use objects meaningfully, we begin thinking about cognitive development and daily living skills. The language milestones at this age are extremely reliable. No single words by 15 to 16 months should always prompt referral. Waiting until age 2 to be concerned can delay support during a critical intervention window. Another key marker is whether the child follows simple one-step instructions by 2 years. This tells us about receptive language, processing, and attention. Finally, and critically, no gestures by 18 months is one of the strongest early predictors of future communication delay. Gestures emerge before words and support language development. A toddler who is not pointing, waving, or showing is giving us a very important red flag. By this age, these concerns are robust indicators that early intervention will be beneficial. At 2 to 3 years, toddlers begin expressing themselves more clearly, playing imaginatively, and showing more independence. Red flags here include significant difficulty separating from caregivers, limited vocabulary, fewer than 50 words, no two-word phrases such as want, drink, regression of skills, speech that is difficult for familiar adults to understand, and limited pretend play. Regression, losing skills that were previously mastered, is especially important. This is one of the strongest red flags across all ages and warrants immediate referral. At 2 to 3 years, children enter a period of remarkable growth in language, play, and social development. Vocabulary size is a major indicator now. A toddler should have at least 50 words by 2 years. If vocabulary is significantly smaller, or if the child isn't producing a range of meaningful words, this strongly suggests language delay. We also look for two-word combinations like more juice, big truck, or mummy help. This shows that a child is beginning to put ideas together, a crucial developmental milestone. Another extremely important marker is regression. If a toddler who previously used words, gestures, or play skills suddenly loses them, this requires urgent assessment. Regression is not typical at any age. Speech intelligibility is also important. By age 3, a familiar adult should be able to understand most of what a child says. If parents frequently interpret or explain the child's speech, or if frustration arises, this is a meaningful red flag. Finally, pretend play is a powerful indicator of symbolic thinking, imagination, social understanding, and language. A child who shows little interest in pretend roles or imaginative play may need support in these foundational domains. By 3 to 4 years, children show clearer speech, emerging friendships, and imaginative play. This is a crucial window for spotting subtle developmental patterns. Red flags include persistent emotional dysregulation, frequent intense outbursts with slow recovery despite adult support, limited imaginative and cooperative play, minimal pretend roles or repetitive solitary play, speech that is less than 75% intelligible to familiar listeners at age 3, difficulty drawing simple shapes, for example, a circle by age 3, reduced peer engagement or avoidance of group play. What differentiates normal big feelings from concern is frequency, intensity, and recovery time. Limited imaginative play gives us clues about symbolic thinking, language, and social understanding. Fine motor difficulties can foreshadow handwriting and classroom skill challenges. Early referral allows targeted support before school demands accelerate. Between 3 and 4 years of age, children demonstrate increased independence, creative thinking, emotional complexity, and social awareness. This age provides some of the clearest windows into developmental differences. Persistent emotional dysregulation, extreme reactions, difficulty calming, or disproportionate distress often indicates lagging skills in language, emotional development, or sensory regulation. A child's behavior is a communication tool. Dysregulation often reflects a skill need rather than a behavioral choice. This age also reveals the quality of a child's play. Pretend play should now include simple storylines, role-playing, and collaborative play. If a child's play is repetitive, limited to lining up toys, or lacking shared imagination, it may be an early sign of social communication differences or cognitive rigidity. Speech should be at least 75% intelligible at age 3. When it is significantly less, children may avoid speaking, withdraw socially, or develop frustration-based behaviors. Intelligibility is one of the strongest predictors of later literacy success. Fine motor skills begin to matter for school readiness. If a child struggles to draw simple shapes, use utensils, or manipulate small items, This may reflect fine motor or visual motor integration difficulties. Finally, this age group starts showing clearer peer interaction patterns. Children should be interested in others, able to join games, and enjoy simple cooperative movements. Children who remain isolated, avoid peers, or find group play challenging are showing important red flags that should not be dismissed as just shy. At 4 to 5 years of age, development becomes increasingly tied to school readiness. Children at this age should be demonstrating foundational skills across behavioral regulation, communication, early learning, and peer engagement. A key red flag is difficulty following group rules, routines, or transitions. This is not simply about compliance. When a child avoids group time, becomes overwhelmed during transitions, or requires excessive adult support, it often reflects underlying challenges with receptive language, emotional regulation, sensory processing, or executive functioning. It's also important to consider the child's language processing. Some children appear to not listen, but what's actually happening is they cannot effectively process the language or the speed at which instructions are delivered. When a child can follow one-on-one instructions but struggles in a group, this is a strong indicator of receptive language or auditory processing difficulties. Speech clarity is another major predictor. At this age, children should be fully intelligible to unfamiliar adults. Children who remain difficult to understand often experience frustration, misunderstandings in social situations, and early impacts on literacy, as poor speech sound skills affect reading readiness. We also observe early numeracy concepts. Difficulty with counting, patterning, or simple number concepts does not necessarily indicate an academic deficit, but it can reflect underlying issues with working memory, attention, or language. Finally, children at this age should show emerging independence in their learning, initiating tasks, persisting through simple challenges, and engaging willingly in structured activities. When these behaviors are missing, it signals the need for a more thorough developmental review. By 5 to 7 years, children are entering the formal learning environment where academic and social expectations increase sharply. This period often reveals delays that were previously masked by adult scaffolding or less structured learning environments. One of the strongest red flags is difficulty learning letter-sound relationships or maintaining consistent progress in phonics. Children with dyslexia or developmental language disorder may appear bright and engaged, but have persistent difficulty identifying sounds, blending sounds into words, or remembering letter patterns. These are not late bloomers, these are early signs of specific learning differences that benefit greatly from early intervention. We also look closely at social functioning. A child who struggles to form friendships, misreads social cues, becomes easily frustrated with peers, or withdraws socially, is often signaling underlying challenges in social communication, emotional regulation, or language comprehension. Early school years are pivotal for shaping social confidence and belonging. Motor skills also matter at this age. Difficulties with handwriting, ball games, balance, or coordination may indicate developmental coordination disorder, DCD. Children with DCD often work significantly harder than peers to complete simple motor tasks, leading to fatigue, frustration, or avoidance. Patterns of inattention, disorganization, or impulsivity can also emerge. While these may resemble ADHD, they can also reflect language comprehension difficulties, working memory challenges, or sensory processing differences. Many children labeled as not listening are actually struggling to process instructions. This is also an age where behavior becomes a window. Children who consistently act out, shut down, or avoid tasks are often communicating feelings of overwhelm or frustration. Behaviour is rarely the primary issue. It signals where support is needed. Early assessment in this age bracket prevents long-term academic and mental health impacts. At 7 to 9 years, academic demands become more complex. Children are now expected to use language to learn rather than simply learning language. This shift often reveals deeper developmental difficulties that were harder to detect earlier. One of the clearest red flags at this age is difficulty with comprehension and higher order language. A child may read fluently but fail to understand what they read. This disconnect can cause confusion for educators and parents, but it strongly suggests underlying language processing challenges. Narrative skills are an essential diagnostic tool. Children should be able to describe a sequence of events, summarize key details, and organize their thoughts. A child who jumps from idea to idea, omits important details, or struggles to retell a simple story may have difficulties with sequencing, working memory, or expressive language. We also monitor executive functioning closely. If a child regularly forgets multi-step instructions, loses materials, struggles to begin tasks, or has difficulty shifting attention, this may reflect ADHD, working memory deficits, or language difficulties. Social emotionally, by this stage, children are expected to recognize more complex emotions, negotiate conflict, and maintain friendships. A child who remains emotionally immature, who responds with disproportionate big feelings, struggles to cope with disappointment, or misinterprets peers' intentions, may need support in social emotional development. Fine motor difficulties can persist into this age group, affecting handwriting, speed, organization, and academic output. These children may be highly intelligent, but unable to show their knowledge due to output challenges. This age group strongly benefits from holistic developmental assessments, as difficulties often involve multiple domains working together. There are several red flags that carry significant weight regardless of the child's age, cultural background, or environment. These should always prompt further assessment. One of the most concerning signs is regression. A child who loses skills, whether language, play, motor, toileting, or social engagement, requires immediate attention. Regression is never considered a normal variation in development. It often signals neurological, emotional, or social communication differences that benefit from early assessment and intervention. Another universal red flag is lack of response to name. This is not simply inattentiveness. When children consistently do not respond to their name, but do respond to other sounds, it raises questions about language processing, auditory responsiveness, and social attentional engagement. We also watch for motor asymmetry, such as consistently favoring one side well before hand preference should appear, or dragging a limb. These may signal neurological differences that should not be overlooked. A child with limited social engagement, whether a baby avoiding eye contact or a school-aged child avoiding group play, may be showing early social communication differences, sensory overload, or anxiety. Finally, extreme sensory sensitivities or highly restricted eating patterns that significantly impact daily life should not be dismissed as quirks. Sensory differences commonly accompany developmental disorders, including autism, ADHD, and anxiety. If sensory challenges interfere with participation in play, learning, or self-care, early support is essential. So what should you do when you notice a red flag? First, document. Be clear about what you observed and when. Second, use screening tools. In Australia, the main validated tools include the PEDS, Parents Evaluation of Developmental Status, from the Royal Children's Hospital, the Ages and Stages Questionnaire, the Brigance Screening Tests, and the Red Flags Early Identification Guide. Third, communicate. Speak gently, supportively, and collaboratively with families. Our goal is to help, not alarm. Fourth, refer. Depending on the concern, referrals may include a pediatrician, speech pathologist, occupational therapist, physiotherapist, psychologist, or audiologist. Finally, monitor. Follow up, check back in, see how the child is progressing. Let's have a look at some case examples. First one is a 15-month-old with no gestures and no words. What do you think should be done? This is a high priority red flag for social communication and language development. Refer to a speech pathologist and a pediatrician and consider a hearing assessment. Case number 2 is a 4-year-old whose speech is roughly 50% intelligible to familiar adults. What do you think we should do? At this age, we expect near complete intelligibility. Refer to a speech pathologist who will explore speech sounds or a motor and language foundations. Case number 3 is a 7-year-old who has ongoing social and academic difficulties. They're struggling with forming friendships and they don't recognize peers' emotions. What do you think we should do? Refer to a psychologist and a speech pathologist who will look at social communication differences and consider language disorder, ADHD, and specific learning disorder. A holistic assessment like this would identify the underlying drivers and be able to plan supports for all 3 of these children. As we wrap up, it's worth emphasizing that developmental concerns rarely occur in isolation. The children we support often present with a unique profile of strengths and challenges across communication, play, motor skills, social development, emotional regulation, behavior, mental health, daily living skills, and learning. Our role as GPs, educators, allied health professionals, and coordinators is not to diagnose, but to notice patterns, act early, and guide families gently and effectively. Early identification doesn't label a child, it liberates them, opening access to the right supports at the right time. Parents and educators are often the first to raise concerns. Their observations are incredibly valuable and should always be taken seriously. When they express worry, it is an opportunity, not an inconvenience, to intervene early. The evidence is clear. When in doubt, refer. When concerned, screen. When unsure, monitor closely. And when skills regress, act immediately. Ultimately, children thrive when the adults around them collaborate, communicate openly, and prioritize early support. Your referrals genuinely change outcomes, and sometimes they change lives. Before we close, here's the key message. You don't have to manage developmental concerns alone. SLCN is here to partner with you. Why refer to SLCN? We have specialized holistic developmental assessment and integrated therapy across communication, social emotional, behavior, motor, daily living, and mental health. We provide clear functional reports with practical recommendations for home, kinder, or school. We collaborate with families, with GPs, schools, kinders, and NDIS partners. We provide timely appointments. We prioritize early access and availability. When to refer. Any child with delays in speech, language, social, emotional, or behavior concerns, motor or daily living challenges, executive difficulties, regression, or persistent parent-educator concern. how to refer, by phone, email, or web, and our location is based in Derrimut in the western suburbs. If a child came to mind today when we were talking about milestones, then that's your referral. I encourage you to think about the children you support every day. If today's session has prompted you to reflect on a child who may need a bit more help, that's the ideal moment to refer. Your observations truly change developmental pathways. Early action prevents long-term challenges and empowers families at exactly the right time. Thank you for your time and for the vital roles you play in children's lives. I'm happy to take questions about red flags, referral pathways, or specific scenarios you're seeing. If you'd prefer, feel free to connect after the session. We're here to support you, your team, and the families you work with.